Muy buenos días desde Perú. Ahora estamos conectados con Jodie Cohen. Ella está en Israel en este momento. Y Jodie es autora del libro de Tikkun Olam, Israel versus COVID-19. Ella es una galardonada consultora en relaciones públicas con más de 20 años de experiencia, incluyendo trabajos en empresas del sector farmacéutico, cuidados de la salud y tecnología médica. También es analista internacional en programas de noticias en la televisión sobre Israel y el Medio Oriente. Jodie, bienvenida. Te cedemos la palabra. Please, Jodie.
Thanks very much. It's really good to speak to you all today. I would just like to begin by talking about partnership working, and what you're doing today at the hackathon is really crucial to that. The idea of bringing people together to solve what is the most serious challenge confronting the world today is really important. And that was my thinking when I wrote the book, Tikkun Olam, Israel versus COVID-19. And that's my purpose for speaking to you today, really to try and share the experiences we've had in Israel, particularly with the vaccination program, so we can all learn from each other and solve this challenge together.
Okay, so we have some questions for you. Maybe you can tell us, how was Israel done so well in vaccinating its citizens?
Right, so Israel has thankfully done very well in the vaccination program. It's number one in the world per capita in terms of vaccinating its people. As of this week, over 3.6 million people have received their first vaccination, and more than 2.3 million have received their second vaccination, which is a quarter of the entire population. So really doing well on the vaccine front. Over 80% of over 60-year-olds have now been vaccinated. And I think there are a number of reasons for this. Firstly, if we look at the negotiations with Pfizer in particular, Israel negotiated contracts at a very early stage, and we've heard that Israel has paid as much as 50% over the regular price for these vaccines. Seeing it as an investment, not only in terms of life, but in terms of being able to get back as far as possible to some sort of normal reality and back to work and boosting the economy again. Importantly, the Prime Minister actually spoke directly to the head of Pfizer and negotiated access for Pfizer to Israel's medical records. And what that means is that the Israeli public, we have universal healthcare here. And there are different levels. They're all run by 4 health funds, and they're all run quite efficiently. And there are different levels of coverage, but everybody has some level of access, and all the records have been digitized for a number of years. So those medical records have been given to Pfizer, if you like, on an anonymous basis. So Pfizer can examine whether people have existing conditions, and also look going forwards, they'll be able to get access to that data. Israel is a smaller country. It's the size of Wales in the United Kingdom, in New Jersey, in the United States. It's a really small country, which means it's at an advantage in terms of distributing the vaccines. So if we need to get vaccines to a remote village, in the north of the country, really you're talking about a few hours drive from the center, where is very far. So that's definitely been something that's, at an advantage to Israel. There's also the idea of bringing vaccines to the people, and also bringing people to the vaccines. So there are, the government started by taking vaccines to the most vulnerable people. So we're talking about elderly people in residential homes, and homes for people with disabilities, and also bringing people to the vaccine. So this might not necessarily be something that the government is doing, but voluntary organizations certainly are doing this, whereby they're bringing elderly people, particularly Holocaust survivors, and they're taking them to the vaccination centers. They're coordinating with the vaccination centers so that the vaccinators will come outside and give them the vaccines outside, and not where they have to stand among other people. So really thinking about the detail and the most vulnerable in society, and how they can get access to the vaccines. And also there's a concept called Rosh Gadol in Israel, which basically means using common sense. So when the vaccine started, at the end of the day, when there were vaccines left over, there were a few hundred that were thrown away because they didn't have people to give them to. Obviously, they expire after a certain amount of time. And Israel very quickly realized, even though the official guidance to begin with was to give to the elderly people first, if at the end of the day they were going to throw away the vaccines, that they would enable people to just turn up and see if they can get a vaccine. And I had friends who did this, who went to the vaccine centers that are all over the country, giving easier access to people so they don't have to go onto public transport to get to the vaccine centers. And the people would come out and would say, okay, who here is over 65, who here is over 60, and find the oldest people, at least in the amongst those waiting outside, to offer them vaccines, but also to use common sense and to offer vaccines to young people as well, because it's better than throwing them away. I can't hear you, Edith, it's on mute.
Yes, but numbers are still high. What do you think is that?
It's true, numbers are still worryingly high. I mean, this week we've seen that the daily number of cases is at the lowest it's been since the end of December. So there are positive signs. We're also seeing that the people who are hospitalized, there are now more under 60s in hospital with serious cases of COVID than there are over 60s. So that's a sign that the vaccination program is starting to take effect. But I think that there are 4 real reasons as to why the numbers are higher than everyone would like them to be. Number one, we've got these new variants that we're dealing with, and at the start of the vaccination program, we weren't seeing these new variants, certainly in the numbers that we're seeing now, with that they can be in the air for longer, that they can be transmitted more easily, and unfortunately result in more serious cases as well. Number 2, it's lockdown fatigue. We're in our 3rd lockdown here. It's hard, in the first lockdown in particular, we weren't allowed to go more than 100 meters from our home. By the 3rd lockdown now, they were saying you couldn't go more than 1 kilometer from your home unless you were exercising, and that you can't exercise with friends, and you can't see people even socially outside, limiting the numbers of people that could be inside, saying you can't be inside other people's houses, limiting numbers outside as well. Very limited places that, I mean, we're all experiencing it across the world, but there's definitely an element of lockdown fatigue, mental health issues as a result of that. And of course, businesses struggling and people struggling, not being able to socialize, struggling with health concerns, struggling with financial worries. It all adds up, and we are seeing people on the beaches. And there are even reports this week of shopping malls that are opening against the law. So the issue of personal rights. Now in Israel, as in many countries across the world, it is sacrosanct. The ability to protest politically is a really, really highly regarded value in Israel. So people, are very much against limiting the ability to protest, and the government has not once said that there cannot be protests throughout the whole of the past year. At times they've been limited in the numbers that have been able to get together, but the ability to protest is sacrosanct, as is, Israel is a very traditional community, a very traditional country with different religions, and the ability to meet and to pray together is central to the religions that are practiced in this country, but also even to people who are not necessarily observant and religious. They're a real part of the culture. And we have festivals throughout the year, and it's definitely a part of the culture, no matter how religious you are, to be able to get together. And so people have been finding that particularly hard as well. And the last reason I would say for why numbers are still high despite the vaccination campaign is the conspiracy theories, which have surprisingly taken hold, particularly on social media. The anti-vaxxers, the videos that we've seen I heard of a friend of mine recently who cancelled her first appointment to get a vaccine because she'd seen an anti-vaxxer video which raised concerns about fertility issues, which is, you know, understandable and shocking at the same time.
Different aspects to deal with. Yes.
Yeah.
Okay. Tell me, what are some solutions Israel has developed to tackle this?
So if we look at the 4 areas of, you know, variants, the lockdown fatigue, the personal rights issue, and the conspiracy theories, there are a number of solutions that are being developed. I'll just mention, you know, some of them. Some of them, you know, I talk about in my book, but they're literally, we see in the news daily reports about innovations that are being created here, and it's really inspiring, and it's really a cause for hope, I think. Israel's known as the startup nation for the past 10 years. I think we've gone from being a country that is innovating and coming up with new technologies that are helping everyone to, over the past 10 years, really becoming a sustainable nation where people have been targeting the biggest issues facing the planet in terms of poverty and health and the environment. And then seen in the past year, people have pivoted again really quickly to try and tackle COVID-19. So if we just look at the 4 issues I'd outlined, so the first one is the fact that we've got these new variants and it's more transmissible. So Israel has come up with, so this, I've got some here. This is my Synovia mask. And I'm not being paid to advertise these, don't worry. But this mask has been proven to be 99.3% effective in killing the virus. So even if I were to go into a shop and the virus be in the air, there's, you know, whatever it is in this mask, the technology kills the virus. So that's definitely, you know, just one example. There's another one here, which is the Maya sticker, which was developed to help protect medical staff in the Galilee hospital up north, in the north of the country. It was right at the beginning of the pandemic when they heard about the doctor actually who was the whistleblower in China, who told the world, you know, what was going on and the death rates and everything. And when he himself died of COVID-19, the medical staff in this particular hospital were talking, and they were worried that they didn't feel safe enough to be protected just, you know, wearing a regular medical mask. So they developed this sticker that goes on the mask, and again, it's, you know, over 90% effective in preventing or protecting the staff from getting the virus. And they are also now selling it to members of the public as well as to hospitals around the world. But even, you know, if you don't have access to these masks, things like I read in the media today, people are saying just wear 2 of the regular medical masks just to add extra protection. So there's constant innovation going on, which is definitely a cause for hope. They won't all be effective, but the fact that such a small country is innovating so rapidly and really using the resources and the technology, the networks that they have, not only to develop innovations to help tackle COVID-19, but to then share their innovations across the world, is really a cause for hope. Now, in terms of lockdown fatigue, you know, mental health, there are free helplines that have been set up to help anybody who's dealing with mental health issues. There's been resilience training that's set up for frontline workers who are under immense pressure, and also the psychological stress of what they're having to deal with on a day-to-day basis. I just can't even imagine it. Financial support for businesses, as you know, we've all seen across the world in news reports. Schools are now cautiously going back to school in yellow and green areas. So they've identified different cities and towns that have worse rates than others. Red is the worst, and my son actually goes to school in a red area. He has been in school physically for 2 days since September. But in orange areas and yellow areas, the schools have been opening and closing as needed, and learning outside wherever possible. You know, right now it's spring, it's not too hot. The rain hopefully is, well, not hopefully, but the rain's probably ending soon. So whenever possible, children are learning with their teachers outside. And the lockdown has been like an accordion. I mean, the Prime Minister's talked about this, the ability to open the tap and close the tap as needed, depending on where the country has been with the numbers. And also enforcement. You know, we've seen a gradual increase in fines for people breaking the lockdown rules and for not wearing masks in public. You have to wear a mask here if you're in public, and it has to be over your nose. If you're wearing a mask over your mouth and not over your nose, you can still get a fine. And the issue of personal rights, communication is really, really important. I know that the government and also health organisations have really done their best to reach out to different leaders in the various different communities here, not only geographic leaders, protest leaders, as well as limiting the number of people that can gather together. The fact that if you want to have a protest or a prayer gathering, you have to wear masks. It has to be outside. So it's been really important. And although it's definitely not been effective in all cases, there are definitely cases of people breaking the rules, people having wedding celebrations that were just too many people together. It's been really important to really reach out to those influences in the community and to the community leaders, and that has had an impact, because when you have a rabbi or an imam saying to their congregants, we're only going to pray outside and we're only going to pray in limited numbers, or even there's a full lockdown right now, we are just not going to be praying together, everyone pray in your homes, that does have an impact. And likewise, when they don't say that, that has an impact as well. And then in terms of conspiracy theories, there's really looking at various different options for incentivizing people to go out and get vaccinated, as well as education.
Definitely, education is a really, really very important factor to educate and encourage people everywhere. If I can add a question, Jodie, I would like to ask you, what can we learn from the Israeli vaccinations campaign from a communications perspective? What are the do's and don'ts? And what would you do? Would you do something different, maybe?
That's a really interesting question. And I think everyone is learning as they're going on with regard to not only what we're dealing with, but how to encourage behavior change. The government has introduced education in schools to teach particularly young children about what this is, and about simple things that as adults we would take for granted, but how to wash your hands correctly. So, and those sorts of initiatives are really important in schools, not just to teach the children, but because those children are known to then go home, influence their families and their friends and their neighbors. So it's the pester power of the kids. And I think that's a really important aspect, and something that probably could be encouraged even more. And then looking at sort of private company communications. I noticed there's a TV channel here and across the world called I24 News. And instead of having advert breaks, they will have adverts that will literally teach the viewers how to wash your hands properly. So, between your fingers and like this. And you think, well, we're adults, we know how to wash our hands. But actually, some people don't wash their hands, and lots of people don't like to admit that they don't wash their hands, and certainly probably don't wash their hands in the way that you see doctors do in hospitals on a day-to-day basis. So things like that have been very helpful in terms of basic hand washing education. And then again, as I was saying, it's the communication to different elements within the communities, different religious groups, to protest leaders, to influencers within the communities as well. And I think that tailored one-on-one reaching out is really important. It's not just some kits, this is our message, and just expecting everyone to pick it up. It really is that personal touch of political leaders going to meet the respected community leaders and going to meet the respected religious leaders, and also meeting the popular protest leaders, and really reaching out on a one-to-one basis to make sure that they understand what's going on and can then in turn reach out to their communities. So it's like a ripple effect of spreading that message out centrally to communities across the country.
I love your conversation. I love your conversation.
Thank you. Hope it's been helpful.
Yeah, so we learn about your best practice. So here we are very expecting about your strategy, how Israel doing with your population, and how we applied it in this development country or poor country, because we have a different geography. So we have 10 million of inhabitants in Lima, or around Lima. It's a city like a normal city of all the world, but we have mountain, we have jungle, and with the real logistic goal, the real logistic challenge is to distribute this vaccine to the jungle. For example, if we need to go to the jungle, we need to use a plane around 1 or 2 hours by plane, then by truck for 1 hour, then by the river using a small boat, and then walk through the jungle, for example, if we need to go to Tampopato. So that's a real challenge, and that's a real challenge for all the population of Peru.
Yeah.
So we are very respectful about your best practice and how you applied it in Israel.
So it's a different challenge because Israel is such a small country that our challenges in terms of access and distribution are small scale compared to that. They really are. Governments perhaps might take Israel's model, what we have done across the whole country, and perhaps they might apply that to different regions across Peru, because that's the difference in terms of the scale and, as you said, describing the types of places that you have to get vaccinations to. I mean, what I would say is that, first of all, the type of vaccine, AstraZeneca's vaccine doesn't need to be frozen at such cold temperatures compared to the Moderna and the Pfizer vaccines. So immediately that's an advantage in terms of getting having portable freezers and being able to take them to remote places. There are also vaccines in development. There's one in Israel that's being developed that would be administered orally, but it's still going through the trial process. And obviously you don't want to wait. You want to try, make your plans now. Yes, if an oral vaccine becomes available, that would be fantastic and would really have good positive implications in terms of distribution. But AstraZeneca, I would expect, would be the most practical solution for the remote areas of Peru. And also seeing how you can get others involved in terms of logistics, getting your logistics experts across the country together. So it's not just looking at the health funds, but for example in Israel, the army has been involved, the health funds have been involved, the local municipalities have been involved, as well as the national governments, really looking at the resources that you have as a country and getting the logistics experts involved to, as you're doing with the hackathon, getting those minds together to solve the challenges that are particular for Peru. And learning from other countries as well and their experiences.
Which are the role for the leaders of Israel? For example, some people said, okay, so we need to vaccinate the president or a social media or an actor or an actress or a TV presenter. So that strategy work in Israel, or maybe you can share us another experience?
I think it really did, because one of the first things that you learn in leadership training is in Hebrew, it's called dugma ishit. It's like leading by example. And when you have the prime minister and the president of the country and the health minister being the first ones to literally roll up their sleeves and show off their pale arms to the country, you're setting an example. You're encouraging others to go and get the vaccine, and you're telling people that, you know, that the health authorities believe that this is safe and that this is our best option of getting out of this terrible situation that we're all facing. So I think it's actually really important that the leaders do that, and the influencers, as you said, the TV personalities, the presenters, the pop stars. It's, you know, on the one hand, you could argue, oh, it's the privileged getting their vaccines first, but actually it's the influencers who are showing that this is what we have to do and encouraging their followers and their supporters to do the same. So I think it really is important to lead from the top and to set an example in getting vaccinated.
Thank you, Judith.
Okay. Thank you, Mario, for your participation. Judy, can you tell us more about what Israel is doing to incentivize vaccination, or what are the plans, or what are the current options we have?
Right, so this is a new issue because, you know, the older population, and suddenly Israel is facing a situation where the vaccination rates are slowing down because they're finding that the younger people are more hesitant to get the vaccine. So the government, companies, local authorities, everybody is grappling with this issue now of how to encourage younger people to get vaccinated as well. So if we look at possibilities that are being discussed, the green passport is one, the ability to be able to travel abroad. Israelis love to travel, really, really love to go abroad, and are finding it so hard not to be able to travel. So the green passport is one issue that is being considered. There was an announcement this week, actually, between Israel and Greece, saying that there would be, you know, at some point they will open up the borders between the countries and enable people to travel to each other's countries as long as they've been vaccinated. And Israelis also, you know, love to go to restaurants and cafes and culture and theatre and gyms and hotels and shopping, especially. So shopping malls, you know, all of these things are being considered, whereby access to these places would be for people who have been vaccinated, or for people who've had COVID, or for other people. You know, it's not infringing on people's rights. If they don't want to get vaccinated, they don't have to get vaccinated, but they will have to be tested every 72 hours, potentially, in order to be able to go into a shopping mall or to be able to eat in a restaurant. So it's different, looking at different options of how to incentivize people to get vaccinated, but without making it mandatory and a law to say that you have to get vaccinated. They're also looking at financial penalties, at the same time as encouraging people to get vaccinated, but saying you can go for tests. They're talking about making it more expensive to test and to make access more difficult and to test fewer people. So it's the push and the pull factors of, you know, get vaccinated because you can do all these great things again. But if you don't want to, there'll also be costs involved. There'll be logistic difficulties. It won't be so easy. Local authorities are considering also financial incentives. So having a discount on municipality taxes if you've been vaccinated. I've heard that Renana this week also announced that if you work for the authority and you have not been vaccinated, you're going to have to wear full protective clothing, which is annoying. But actually, if you think about Renana specifically in the summer, it's very, very humid. It's very hot. That would be very uncomfortable. So it's another just things to nudge people into just thinking, okay, life will be much easier if I'm vaccinated. Companies as well. So more and more companies, especially the large companies, you know, everybody is running their sustainability programs, their corporate social responsibility initiatives. And they're really also starting to look at what can they do to encourage their employees to get vaccinated. So there are some companies that are looking into saying to their employees, you can't come into the office if you're not vaccinated or if you're not tested every 72 hours. There are some who are looking potentially at putting employees on unpaid leave. And also on the flip side, looking at the positive incentives, there are some companies who are saying that they'll give bonuses to their employees if they get vaccinated, and they'll give their factors, the pull factors, things that might, just make life that little bit too difficult, that encourage younger people to get vaccinated, as well as the benefits of if you've been vaccinated. Just to reiterate that the vast majority of people in this country are so unbelievably grateful for the opportunity to get vaccinated, and it really is an issue that we are seeing globally with the anti-vaxxer movement, and particularly on social media, that their influence has grown, and with concerns of younger people. So we're really looking at these incentives as a means to encourage younger people to get vaccinated, although people of all ages will benefit.
So I think that the words push and pull are going to be very, very important in this process. Yes.
Absolutely.
Okay. Thank you very much, Judy. Hakeem, please. Be my guest.
Hi, so I want to thank you again for being with us and for sharing your experiences with the hackathon Vacúnate Perú. And also, I think that if I can summarize most of what you said, one of the main ideas that you have said about the communication campaign is trust. If you are able to get the trust of the people to actually join the vaccination campaign, then you're in, and you're in for a really successful vaccination campaign. If you're unable to get that trust, or if you're unable to incentivize or show innovation and about adaptability in the vaccination campaign, then it will be by far more difficult. And again, thanks for sharing the Israeli experiences with us today.
It's a pleasure, and I just want to wish you all good health for the coming years, good health from COVID and from financial worries, and just pray that, that this event creates some incredible ideas and brings people together. And it's just been a privilege to be able to share Israel's experiences with you, and I look forward to hearing the results from the hackathon as well.
Okay, thank you very much, Judy. Thank you very much.
Thank you.
Bye-bye from Peru. It's Lailatov, yes? Still?
Yeah.
Okay. Bye-bye.